Okay, hello and welcome to Pituitary Network Association's webinar, Pituitary Disorders in the Family. Pituitary Network Association is a nonprofit organization that relies on the support of our members and donors. We offer this webinar series to help educate patients, their families, and the healthcare providers. During the webinar, feel free to type in your questions at any time. Please note that all questions will be saved until the end of the webinar. We have allotted time to answer as many questions as possible. Any questions that are not answered will be reserved and answered by email. And as I said, today the webinar is Pituitary Disorders in the Family, presented by Dr. Jamie Banker. She is the Director of Counseling and Psychology Master's Program and Assistant Professor of Psychology at California Lutheran University in Thousand Oaks, California. She is a licensed marriage and family therapist and has a special interest in integrated behavioral health care. She completed a clinical master's degree at University of San Diego and completed her doctoral degree at Virginia Tech. Dr. Banker was a doctoral intern at Dartmouth College Family Medicine Residency. Dr. Banker has worked in 3 integrated primary care practices as a therapist and a lecturer. She has published scholarly articles and a few book chapters on integrated health care. Now her focus is on training marriage and family students to work in integrated behavioral health care sites. You can read more about Dr. Banker on the PNA website at the webinar description page. Okay, welcome Dr. Banker, and I am going to go ahead and change presenters and let you take the floor.
Okay, well, welcome. Thank you for being here for the webinar on pituitary disorders and the family. I'd like to just go over for a moment the various things that I'm hoping we will cover today in our webinar. While we're talking about pituitary disorders today, we are also thinking about the family. I think it's important that we acknowledge why we're thinking about the family and why the family system is such an important topic when talking about illness or specifically disorders of the endocrine system. The family system is really is one of the main systems that is affected by any sort of diagnosis. And sometimes we just look at an individual or just look at the problem and forget to look at the context in which that individual or a disorder exists. So that's the reason that we're going to focus on the family system today. We'll also look at some of the primary effects of chronic and serious illness on a family system, and more specifically the ways that pituitary disorders impact the family system. I want to spend time talking about how family members can have a positive impact on management and care of pituitary disorders, and potentially other resources for family members. And integrated care and collaborative care is something that I see as a resource, so I want to talk some about what that is, as well as the role of a psychotherapist or a family therapist when people or families are dealing with a pituitary disorder. So let's start by talking about the family system. I am a licensed marriage and family therapist, so family systems is something that I think about all the time. All the work that I'm doing integrates a family, and I work very closely with a medical model as well as in psychotherapy. And so historically in our medical literature, so literature that would talk about these disorders, talk about the etiology, the origins of these disorders, and treatment protocols, would really just focus on the identified medical patient. So we really just focus on the disorder and the patient that was dealing with it. Whereas more recently, literature will focus on not only just the disorder and the individual, but what all is going on around that individual and that disorder, as well as how is that disorder having an impact on the environment around the person. So in other words, there's literature that will talk about sort of the physical and mental toll that it might take on those that are helping care for or manage some of these disorders, or how the family themselves might also have an impact on the severity of the symptoms or the management of the disorder. Family systems theory is a theory that I work from myself as a family therapist, and it really is saying that in order for us to fully understand what's going on with somebody and what's the best way to really manage what's happening with somebody is to look at the entire system. So family systems theory would sort of tell us not to just look individual, not to just look reductionistic, but to look at anything, the context in which something exists. So we're going to talk more about family systems. According to family systems theory, we don't want to just look at one part of things when we're considering a whole person or a whole family. Every part of an individual or a family system is related to each other, so every part sort of feeds off each other. In other words, nothing lives in isolation. None of us really act or react to situations unless there's things around us to act or react to. And so family systems theory is saying that we have to take all of those things into consideration, what's around us, what's around a disorder, what helps manage a disorder, in order to truly understand a disorder. A common example of this that we might see in the family therapy field would be maybe a child that is acting out. A family may come to therapy if they have a child that's misbehaving or acting out, and instead of just focusing on how to change that child's behavior, family systems theory would tell us that we need to look at everything that's going on around that child. What might be happening around that behavior that's either encouraging it or keeping it there. Perhaps a child is looking for attention from their parents or looking for their parents to spend more time with them, and that could be a potential cause of them acting out. In that case, the family systems theory would say we have to look at that whole family to truly understand what's going on. If we only looked at the child, we wouldn't know that. And this is the same situation when thinking about disorders. When we think about how to manage, how to care for, we have to think about how is that disorder being managed and cared for in the whole family system. Inevitably, people that are diagnosed with a chronic or serious illness, it will affect a family system. It's almost impossible for it not to in some way, shape, or form. So I'd like to talk about the primary effects of chronic and serious illness on a family system. Again, chronic illness affects individuals and families. From a family systems theory, it becomes clear that focusing only on the problem of one family member acknowledges only one part of the affected system. So from a family systems perspective, only one member's experience can affect the whole system because each family member is interconnected. Sometimes when someone receives a medical diagnosis or is experiencing a medical illness, the entire family will experience a ripple effect. They will experience the acknowledgement of this disorder, how this disorder might have an impact on all of the family. And sometimes the family members, not only just the person diagnosed, but all the family members may sort of resist this diagnosis in some way because it does affect all of them. So the illness impacts the whole system rather than just the individual with the diagnosis. I like to think about one of my examples is how when we think about family systems, it's very similar to how we think about our own bodies. So our bodies are all an integrated system that work together. It's hard for us to just think about the heart without thinking about arteries and veins and everything that plays into our heart's functioning. Similarly, if our heart was to stop working, it's going to affect all the other symptoms in our body. Families work just like that in a whole system. If one family member changes, it changes everyone else in that family system, and could change the functioning of the system too. So this happens when people are diagnosed with chronic illness or a serious illness, because it can change the way the family system is set up. An entire family system must adjust when one family member acquires a disability, regardless of the symptom severity. So regardless of how much those symptoms are really impacting the functioning or really impacting the other family members, regardless of that, it inevitably is impacting those around the person that has been diagnosed. So this could be family, significant others. It could have an impact on work, on their social life. So the process of adjustment to a family member's diagnosis can mirror that of grief. It can look like depression. It could, some family members may have a reaction of anger when hearing about these diagnoses. So family dynamics become complicated because each family member will have an emotional reaction to a potential diagnosis or to managing a diagnosis. And health problems can create or exacerbate conflict within a family system. So just the idea of a diagnosis or dealing with symptoms that perhaps other family members are not dealing with, just the knowledge of doing that can create problems or create conflict in a family. Or if conflict already exists, then some of these symptoms or diagnoses can make that conflict even greater. It can sort of exacerbate the conflict. Families often have dysfunctional ways of interacting. That just happens to be true for many, many families. And even before the occurrence of a major stressor. So once another stress comes into place, like a chronic illness or a serious illness, then those dysfunctional patterns can either become worse or become a little bit more activated. The impact of pituitary and hormonal dysfunction on a family just can't be overstated. I would like to give a few specific examples just so that it's clear why it's important to think about the whole family system when we're thinking about pituitary disorders specifically. So my first example might be a person with a pituitary lesion. If we think about their thyroid hormone, their cortisol, their GH, it has some deficiencies or deficiency, which could result in symptoms like a low libido, a low sex drive, maybe erectile dysfunction for men, or menstrual cycle dysfunctions for women. And most commonly they would have some fatigue as well. Something like that may come to an office like mine, a psychotherapy office with marital dysfunction. You can very much see how these symptoms could affect a significant relationship, an intimate relationship, and that in and of itself has an impact on the family. Someone with pituitary disease could commonly have symptoms of apathy, sort of a lack of interest, sort of a lack of energy, perhaps their speech is bland, sort of monotone, and those symptoms very often get translated into that person being uninterested, maybe being insensitive, just not wanting to be a part of the family system or not caring about what's going on in that family. And then families respond to that. So they might respond in a way that they're angry or mad. It's not uncommon for family members to become more distant or more isolated when they misinterpret symptoms like this. And so the more isolated people can get, the more severe some of their symptoms can become as well. Really, any of the symptoms in the pituitary disorders could decrease the overall contributions that that person may give to the household. So again, this is very much a family systems issue because the daily household chores can result in sort of family resentment, disagreement, again, potential distance in the family. And my last example would be medical treatments. Some medical treatments are very time-consuming. Some are very expensive and can cause financial strain. Oftentimes in a family, somebody or multiple people have to take a caregiving role. If that's the case, again, this can be transition and change in the family. Some people may be happy about this change. Some people may be very upset about this change. All of this impacts the family system. So what's most important to think about is how can the family unit really work well if they have a disorder like this in their family, if the family system is dealing with a diagnosis. How can the family members positively impact management and care for pituitary disorders? Again, I just want to remind you that the relationship between a family, between the family system and a pituitary disorder or any chronic illness is bidirectional. So pituitary disorder symptoms, they can be co-occurring, which means that they might have physical symptoms as well as mental health symptoms. And those symptoms can have a great impact on the family members, just like the examples we just talked about. However, it's also important to know that the family and the home environment can also impact the symptoms. So it goes both directions. The family environment, depending on the level of stress, the way the family may handle stress. We talked about the possibility of people isolating or becoming more distant when dealing with stressful things like illness. If there's trauma in the family at all of those situations in families absolutely can impact the symptoms that somebody with a disorder may experience. And most often, any stress in the family would exacerbate those symptoms. So it's not only important to sort of think about how the pituitary disorder affects the family system, but it's also really important to think about how does the family sort of manage and handle the pituitary disorder in a way that makes the person dealing with this disorder sort of the best family member that they can be. So I have some specific things that I would like to talk about that are important for family members to do as a way to support one another and as a way to positively impact, as a way to make a positive influence on how to manage and care for these disorders. The very first one is one of the most important ones, so it's in order. It is really about understanding the disorder fully. What happens with some of these pituitary disorders is that some of the disorders, some people may experience disorders where some of their symptoms are not so obvious. Now there's the other case too where some of the symptoms can be quite physically obvious, but there's times where the symptoms might not be physically obvious at all. And when that's the case, we talk about those sort of being invisible disorders, that when they are that way, there can be a lot of confusion and question about what that disorder really is. When family members can't see the disorder, they may question what the limitations that their family member may be experiencing. So fully understanding a disorder is really important. It's not that uncommon for people to say that somebody with a disorder is faking their symptoms or exaggerating the symptoms. This is extremely frustrating for family members on both sides. The person dealing with the disorder, of course, could be ultimately extremely shamed and confused and angry about the assumption that they might be faking some of what they're able to do or not do. But family members also end up being quite confused, potentially angry, disappointed when they believe that their family member is maybe not being honest with what's happening with their disorder. Most all of this comes from not fully understanding the disorder. In order to fully educate, families become educated about the disorder. So what is the disorder, the name of the disorder, the potential treatments, all the potential symptoms involved in the disorder. Being able to have that type of education also requires being able to talk about the disorder. Talking openly about the disorder is one of the most important aspects a family can have in order to manage a pituitary disorder. Talking about it and becoming very educated so there's no assumptions about what's going on, misinformation about what the disorder is. Talking about it is also a way to acknowledge the disorder. And acknowledging what's going on and acknowledging that your family has this within their family system to manage is also a way to move towards acceptance. And acceptance is one of the greatest pieces about sort of healing and managing a disorder when a family system has this. Number two, so the first one is to educate yourself and fully understand the disorder. Number two is to focus on integrating the disorder into your family unit. What I mean by this is that it's very important that family members acknowledge and recognize the disorder and know as much as they can about it. But it's also very important that the family system is not controlled or ruled by the disorder. Family members have to make a place for the disorder in their family. That means maybe potential accommodations, maybe family members taking on new roles in the family, whether there's some caretaking places, whether there's things that certain family members are better at than others. And it's okay that they find the place for the disorder. But what happens when family members aren't able to talk about the disorder is sometimes it can feel like the disorder takes over the whole family. Because they have not found a good way to manage it. The ways that families react to and process the diagnosis of a disorder can have an impact on how the individual integrates this into his or her own identity. So the family member's sort of acknowledgement of the disorder, hopefully acceptance of the disorder, is a way for the family to decide how they're going to manage it. But it also has a great impact on how the individual with the disorder makes sense of the disorder for themselves as well. And how they're able to sort of think about their disorder and deal with their disorder has a great impact on the severity of symptoms. So symptoms can get worse when people are not able to integrate. In other words, they're not able to sort of make sense of how they'll manage the disorder, then the symptoms can actually get worse. Staying attuned to unresolved feelings about the disorder. It's really important that people realize that everyone involved, so the person that's been diagnosed, anyone else in the family that is involved, can have a lot of feelings about the diagnosis or about the management or care of the disorder. And those feelings are all completely appropriate and acceptable and have to be acknowledged that they're there because it's natural for everyone to have those. What happens sometimes is that people aren't paying attention to those feelings, and so those feelings get expressed in other ways. They might get expressed in how we talk about the disorder. Perhaps people will notice that they're talking about the disorder very derogative terms, how much it's affecting their life. They might sort of express their dissatisfaction, their anger, their discomfort with this disorder in ways that become unhelpful to manage the disorder. It also can be important for people to maybe be in therapy, find ways to really resolve some of the feelings about the disorder. And it's appropriate to have these feelings, as we talked about before. People might experience grief or loss because it's a change. It's an adjustment. It might be a way that you never envisioned that would be the way you were going to live your life, or never have that in your family system, and now you do. So it's fair to have all of those feelings, but also very important to acknowledge them and handle them so that they don't interfere with how you deal with the whole family system. Determine how to handle the disorder publicly. Again, this goes back to the open communication about the disorder and what the family member that has the disorder or the diagnosis, how they want to deal with this outside of the family. So what meaning does it take on in the family? Oftentimes, people might keep the disorder secret, and this is common to happen in families that don't talk as openly about the disorder within the family. It might be secret to the outside world because, again, some of these can be invisible sort of disorders in that their symptoms are not so outwardly obvious. But individuals the management and care of the disorder can be affected if the disorder is hidden as well. It's important for family members to think about how they want to seek support for the disorder, seek support for the individuals involved. But it can be very common for them to decide to keep it secret and not talk about the disorder publicly. And then sometimes they miss out on opportunities to connect with those that are having a similar experience, connect with other families that are dealing with similar experiences. It's not required that people talk publicly about these, but it's important that everyone is on the same page about whether to do this or not, and how much that will affect the support that they could receive. We talked just a bit about reconfiguring roles. It's really common for family members to have to reconfigure their roles. Think about what their role is as a spouse. Think about what their role is as a child in the family, what they help with, what other family members need help with, how they express, how they're dealing with things. This change in role functioning may cause family members to have to change roles that weren't their roles in the past and now they are. So for example, when a person with a pituitary disorder is a parent, the responsibility for child discipline or child care there might be times where other people have to be responsible for child care if there's times where that person is not physically able, maybe due to their physical health or some of the fatigue or any of those kind of symptoms that they may be dealing with. So as a family, sort of acknowledging the various roles that people play. And what I want everyone to really know about the family system and pituitary disorders is that a family is such an amazing resource. So while family members can be greatly affected by these diagnoses and managing these disorders, as well as the individual being greatly affected by their family members' ability to deal with the diagnosis and manage the disorder, the family also is one of the best strengths or the best resources for people with any of these disorders. I never want families to forget about focusing on what they're doing well. And what I see in families when they're dealing with chronic illness or a pituitary disorder in this case is there are things that they are just doing really, really well to support one another and manage each other, but we tend to not think about those. All the families that I have met and worked with have some really positive aspects, but we're not always good as individuals or as families to continually remind ourselves about those. So we have to remember our strengths. And all of this can happen, I think this is on my next slide too. All of this can happen for a family to really be a resource when a family is educated. So it goes back to really understanding the disorder, educated, aware of their own feelings, right? So being aware of that, being aware of their own needs, and openly communicating about the disorder. Because the open communication can talk about how you're going to address this outside the family, what your roles and rules are going to be within the family. That open communication helps you address all of the other pieces that we talked about. So please remember that the family is a great resource, and that all of it, you can be resources for one another, especially when you are educated and fully aware of the disorder and the potential symptoms, about your own feelings, and have open communication. So in addition to the family being one of the best resources, I also think that there's a few other resources I would like to talk about, and one is collaborative or integrated care. I don't know if we have any medical providers or psychotherapists, mental health providers that are listening to the webinar today, But some of these suggestions would be specifically for you as providers, but also to educate any of our family members or any of the people that we have with pituitary disorders on potential resources for them. So integrated behavioral health care also used to be called collaborative care and is sometimes shortened to integrated health care. The most recent term is integrated behavioral health. Integrated behavioral health care is an interdisciplinary field. So it's where we bring the mental health and the physical health together to really treat illness and to treat people. Because when we think about people, they are all a part, their mental health and their physical health is all very integrated, just like how we think about families. So integrated care is looking at how a physician, a family therapist, other mental health professionals can work not just in primary care, in specialty care, in endocrinology, in any of those places together to provide a holistic treatment to people. And that's what we're talking about throughout this whole webinar, is that the symptoms and the biological aspects of what happens to someone's body are just extremely important, as well as the context of what's going on in that person's life. And so integrated behavioral health care can help address both of those. So it promotes a biopsychosocial, so the biological, the psychological, and the social system of someone's health care, and embraces how illness affects families and how families affect illness, because as we talked about, it's bidirectional. So the integrated behavioral health care, again, is a biopsychosocial framework. So it theorizes that biological, psychological, and social factors may be causes or have correlations with related to our mental health and our mental illness. So it's integrating biological, psychological, and social. We have some pretty significant healthcare providers, our Health Resources and Services Administration, our Substance Abuse and Mental Health Services, and our American Academy of Family Physicians that have all said that we want to include integrated care into our practice. So they've recommended that mental health and behavioral health be a part of the medical model as a way to really serve the health care of people. And the role, there can be a role of a family therapist within that medical model, as well as that medical model needs to also include sort of the psychosocial things that are going on for people as well, because what we know is that both can have a great impact on people's health. So the stress in their life, how the support that they have, all of that has a huge impact on our immune system, our health, and how we manage chronic illness, as well as sort of our biological disorders could have a huge impact on how our family system function and how we manage the other parts of our work life, our social life. So integrated behavioral health care is one of the resources that I wanted to talk about, but I also wanted to talk about the potential of psychotherapy or mental health services as a resource for families that have a pituitary disorder in their family. Family psychotherapy has been demonstrated as effective for a variety of physical illnesses. So we've had quite a few physical illnesses that have had extensive research saying that family therapy is one way to treat some of these. Although marital and family therapy is not sufficient alone, because we're talking about illnesses that affect both our mental health and our physical health. So we want to treat the physical aspects outside of a psychotherapy, but we also know that it's a critical component to the treatment is to include the psychotherapy as well, or the marital and family therapy. We talked earlier about examples in pituitary disorders where we might see specific marital strains, specific issues that are coming up about intimacy. We might talk about bigger family conflict that happens when family members are not playing a strong role in the family, whether that's with their interest or with the chores that they do around the house. All of those things absolutely have an impact on overall symptoms and are equally important to address as also dealing with the medical care. Family therapists are trained to collaborate with other professionals, and I think it can be really helpful for those dealing with pituitary disorders or other chronic illness to work with a therapist that can also collaborate with your medical providers. Systemic therapy includes the assessment from this biopsychosocial model, and so collaborating with a patient's physician can be really helpful. It goes back to this idea of really being knowledgeable about the disorder, knowing what sort of roles various family members need to take, and the therapists themselves can help be a liaison with the medical system if they can be in contact and be aware of all the important aspects of the disorder as well. The therapist can facilitate and educate about supporting one another. So again, I see the family as one of the biggest resources, but sometimes as family members we don't always know how to support one another. And we have to feel like our role in the family has been sort of acknowledged in order for us to provide the most support for others. So sometimes we're good at doing that without a therapist, and most of the time we need someone to facilitate some of that for us. So acknowledging every role in the family and helping educate and empower the family about the disorder and educate and empower the family about their resources. This is something that I had recommended that families do themselves, but this is an area where a therapist can also help families do this. It's really important to process everyone's experience of the disorder. As we talked about, lots of family members can have unresolved feelings about the diagnosis or the management of a disorder, and we will tend to think about the individual with the diagnosis, although the individual with the diagnosis can very much have unresolved feelings. We tend to those feelings a little bit more than we do to the other family members. So in a family therapy setting, it's important to learn what everyone's experience is of their loved one's diagnosis. Allow the family member to speak openly about the disorders. So family members, there's research to show that the management of disorders is much more successful when family members allow each other to be honest and safe and caring about all their feelings about the disorder, the positive ones, the negative ones, and then they can talk openly about how to manage the disorder itself. So again, this is a recommendation for the family, but this is an area where a therapist can really help each individual sort of process their experience, because each family member does have an experience with the disorder and will have some emotional tie to the disorder. The therapist can help make sense of the disorder within the family. So again, you may remember that this is something that I recommend the family to do. I think it's unfortunate when a disorder takes over the functioning of an entire family or becomes the only focus, because it's important for that disorder to have a place in the family. The family needs to learn to manage the disorder, but it's not okay for the disorder to be in charge of the whole family. And it's not uncommon for a person to feel that they are damaged or that they have damaged their family, and that is not the case. There's many ways to handle these disorders and handle it within the family. So stories and storytelling can be really important when we're making sense of disorders and making sense of their role in the family. And this, I think, it can happen more easily in a therapeutic setting. It can be very difficult to do just at home, just among your family members. An important thing that I do when working with families with chronic illness and pituitary disorders is really talk to my families about family secrets. There's so much emotion tied to family secrets, and a lot of times people keep family secrets as a way to protect their family members as a way to do something positive for their family members. But that's not how it always turns out. So there's a lot of potential confusion in family when we have family secrets. And the reason I talk about family secrets today in this presentation is because it's not that uncommon for us to keep disorders a secret. When it's a secret, then that means we're not talking as openly about it, and usually means that we don't have as much education on it because we're not talking about it. So just that creates confusion. It also can indicate that people are ashamed or embarrassed of the disorder. That's one reason that they're keeping it secret. But really, protecting their family and their loved ones is the most common reason for people to not talk about the disorder, try not to make the disorder a big deal, try not to talk publicly about the disorder when we talked about that. But when we don't talk about it, there's a lot of implied meaning in that, and the implied meanings can be very hurtful. If a family member with a diagnosis decides that they don't want others to know about the disorder, that's fine, as long as it can be discussed among the family members. There still needs to be open communication among the family members. Families can absolutely make the decision to not be public, but it can't be kept a secret within the system because there can be very harmful repercussions of that. And oftentimes there's a lot of misconceptions about why people aren't talking about it. Maybe because they themselves feel like they shouldn't acknowledge it, or that they are a problem for having this disorder. And, you know, therapists, I think, can help make sure that families are getting any of the resources and supports that they need. Many family members might not choose to have any sort of disability services if they don't feel like they need them, or perhaps they don't qualify for them. But oftentimes people will push themselves to function so that they don't have to have any of these extra accommodations, when really that can worsen the condition or worsen the symptoms. So I think it's important to have resources that can look into any extra supports a family could receive. They also might have missed opportunities by not having accommodations. So they might have missed opportunities for employment or education if they aren't getting the accommodations they need to be successful in their employment or education. And pituitary disorders are comorbid. That's what we talked about. The comorbid piece is that there's a physical element and a mental health element to these pituitary disorders. And so emotional dysregulation, depression, anxiety, maybe some cognitive dysfunction, confusion, maybe a little sex drive, anger, apathy. All of these emotions can happen when people are experiencing a pituitary disorder. So a therapist's role can be able to help people manage some of the mental health symptoms that they're also dealing with, and help a family construct a plan on how to manage some of these symptoms. Again, many times it might be one family member that's really experiencing all of this, but as we know that when one family member experiences it, it makes an impact on the whole family. So a therapist could help create new norms in the household. Each family member and the whole system are really important when we consider any of these disorders. So a therapeutic treatment of pituitary disorders is sometimes unique, because oftentimes people will just seek medical treatment once they've been diagnosed. Some of these disorders can be very misdiagnosed, and then they might seek a therapeutic treatment if they're only aware of some of the mental health sort of symptoms. But a family system perspective allows the whole person to be considered when managing the hormone disorder. So the whole system, the whole family system, sort of everyone that's involved. I just want to say quickly that in the new book, The Hormone Factor, Mental Health and the Pituitary book that just came out with the editor, Linda Rio, has a chapter that I have co-authored in there about the impact of endocrine disorders on the family and social life. So much of what we've talked about here, although it's much more elaborate in the chapter, if you're interested, there's a place to read more about this. And I wanted to mention just lastly that I am conducting a research study currently on people that have been diagnosed with pituitary disorders and looking at the relationship between any of their childhood experiences and pituitary disorders. Specifically looking at people that may have experienced extra stress, perhaps trauma, and how that relates to sort of any hormonal dysregulation later in life. And if any of you that are listening know people or you yourself would be interested, I would love to have you participate. I have a couple pages of references for anyone that's interested in where I gathered all of this information, and I appreciate you all listening today.
Okay, well, thank you, Dr. Baker. We do have a couple of questions to ask you. The first one is, how do we go about setting the integrated care model?
I'm sorry, can you ask it one more time?
How do we go about setting up the integrated care model?
Oh, good question. You know, I think it's happening more and more often. There's hospitals and places around here that are practicing from just integrated care models. So I recommend that people, as they find their physician or if they already have a closely established physician, to ask them if they practice from an integrated care model. It's becoming much more common, and as we talked about, some of these organizations are requiring that people practice from this type of model, and we'll see what happens with the healthcare system, but it's likely that this will become much more of a norm, but there's many people practicing this way already.
Okay, thank you. The next question is, how do you find a therapist?
You know, that's a good question also. I practice marital and family therapy because of the importance of sort of looking at the whole family system, and so then I recommend, if you're looking for a person that practices from that perspective, is I recommend looking on a website that's called AAMFT. That's the American Association of Marriage and Family Therapists. You can also look on the APA website, which is the American Psychological Association, and on that website you can put in Thousand Oaks, California, you can put in New Hampshire, you can put in anywhere, and it'll pull up the therapists in the area. And then, of course, you know, many of us are confined to therapists that are in our insurance, that our insurance will pay for, and so then it's just a call to your insurance to see who would be covered in your area. But I think that it's really important when people have so many pieces of potential stress impacting them to have some kind of support like therapy.
Okay, great. I think it also, I might add that it's important to have a good relationship too. If you don't, you know, you need to get along with that person in order to be forthcoming with your disorder.
Yes.
Okay, I have a couple of questions here about the research study. Can you go back to that slide so that we can post that so that people can see it?
Yes.
And then on the pituitaryresearch@gmail.com, that is supposed to be research, right? It's got a typo on it.
Thank you for pointing that out.
Oh, you're welcome.
Yeah, that's very helpful because I don't want you to email the wrong place.
Yeah, it's actually one of the questions on here was asking.
Oh, good job. Those
Yeah.
of you paying attention, good job, thank you. The research, we just collected pilot data for this research, so we actually will not start collecting data again for a couple months because we're just in an analysis process, and then we'll start collecting for our bigger study. But I'm happy to have people contact me now, and we'll get back to you right away, but we won't actually start collecting the data for a couple more months, but it would be great to have names of people that were interested.
Okay, great. Okay, and I have one more question. Let me pull it up here. Do you have any thoughts on Cushing's recreating the stress of an abusive childhood or any connection between pituitary disease and childhood stress?
You know, all the information that I have about that are just my own hypotheses. So I think it's a wonderful question, and actually that is exactly what we're hoping to get at in the research that we're doing currently, sort of looking at how stress, and specifically childhood stress, could impact sort of these diagnoses of the pituitary disorders. So my answer is no. I don't know anything. I don't have any empirical research or empirical data that suggests that that is actually true. But I think that we have a lot of hypotheses about how those could be connected, and that's why we're going to do this research right now. The more that I look around, there's not that much research looking at this yet, so I'm hoping that we can sort of increase the literature on that.
Okay, great. And then there's another question. Is there a way to get a copy of the PowerPoint notes?
I could provide them to you, absolutely, if there's a way.
Okay, and then we will get them via email to the listener. Okay, well, I think that's all the questions we have right now. We want to thank you, Dr. Banker. And this concludes our webinar presentation. If we didn't get a chance to answer your question, we will be answering them via email. The P&A wishes to thank you for participating in our webinar. There will be a brief survey after the webinar. Please fill it out to help us provide you with the information you need. And we thank you all for being here today.
Thank you.
Thank you.